Okay, I'll go ahead and kick this off. Thank you so much for joining us today. This is our first ever Dignitel Ross webinar. My name is Walter Bergman. I'm a VP here at Dignitel, and we'd like to thank you all for engaging us for the next 20 to 30 minutes. Our goal today is to share some insights that will help in your oncology department make better operating decisions, which may help in your search for partnership alternative options during this intense cost-cutting time. Our webinars will be a hosted series of technical and clinical talking points as they relate to radiation oncology that maybe in your search for that maybe you won't hear, that maybe the topics in our webinars you won't hear from some of the biggest voices in our industry. Today's talk will primarily be about the absolute importance of ARIA and Mosaic, PHI, and system backups, and how to stay safe and protected from cybersecurity with bulletproof backups. With the biggest news in our industry coming this week, we don't necessarily know where Varian or ARIA are going to be in the next 2 years, but we can tell you this, that Dignitel will still be here servicing ARIA software. We're going to ask that you hold your questions until the end. Again, my name is Walter Bergman. You can email me anything direct here at walter@dignitel.com during the webinar, or there's a posted Q&A down here on the Zoom meeting where we're going to be answering any of those questions posted. So again, the three topics for today that we're going to cover: what is end of life and what is end of support? What does the difference between those two mean? Whether it's in Windows XP or a particular software or hardware platform. We'll address the manufacturer's issues when they issue these notices and what we should be doing when we receive these notices. If your facility is equipped to handle potential failures, are proper backups being done? What goes into proper backups, and where does the IT department stop and the OEM's coverage for assumptions begin? In other words, what do you need to know today and why? We will touch on a little large Midwestern hospital case study that lost their ARIA server and the painful path to getting them back up and treating patients. A very brief case study we'll share with you today. Dignitel with closer to 100 years than 75 of oncology software experience on our team. Also speaking with me from the Dignitel side will be Sam Nathan. Sam is a senior partner here at Dignitel and comes with over 20 years of Varian product support, engineering, software support experience, 20 years of ARIA training, 20 years of all possible field service roles as related to software service with the biggest of OEMs. With that, I'd like to introduce John Vano, is the president of ROS, a preferred partner of ours here at Dignitel and a collaborator in this webinar project. John, please take a couple minutes.
Yeah, hey Walter, thank you so much for having me on. My name is John Vano. I am with Radiology Oncology Systems, also known as ROS for short. And we are in the business of refurbished equipment, and we provide refurbished linear accelerators to radiation oncology facilities really across the US and across the world as well, to price-sensitive customers that can't always afford new equipment. So up until this point, we have not been able to offer our customers any type of software support. We install and warranty the LINAC, but after that, the customer is pretty much on their own when it comes to software until now. So this is why we're so excited to be a part of this Dignitel movement. For the first time ever, 20 plus years that I've been in this business, but for the first time ever, there is a fully functional, very capable, independent, third-party company offering software support for oncology software, which is really, really exciting and very revitalizing for us, because we can now give our customers assurance that we've never been able to give them before, that having older systems running with older software versions doesn't put them at risk. And that's what we're going to be talking about a little bit today. And so you guys have already helped our clients in a very big way. And we're here to support you and to learn more about, what we can do to continue supporting our clients. So thank you for having me, Walter. I'll turn it back over to you, and I appreciate it.
Yeah, thanks, John. Appreciate that. So to kick off the three main topics, again, we're going to start on end of life. We'll get into backups and sort of conclude with that quick Midwestern hospital case study. But to start this off, we've got to introduce Sam Nathan. Sam, just to sort of kick one over to you here, let's start with end of life. There's a lot coming from the OEMs, from Microsoft, Juniper firewalls, OEM software, version level platforms and hardware, and the rest. Sam, what can you tell us? What can you tell us in your experience with end of life and these letters? And
thanks, Walter. Hi, everybody. Sam Nathan here. Real quick, I wanted to touch on that, and Walter and I are going to go back and forth and talk a lot about these backups and end of life and end of support. But right now, I want to point out the difference between end of life and end of support. So end of life is when the manufacturer decides that it's time to introduce a new product, and they're going to move on from this particular product. And that happens, whenever they decide that the product is no longer suitable, and it's usually followed within a year or two by an end of support letter. And the end of support is really the important one. End of life means there's some new product coming out there, but end of support is what we pay attention to. And that's where the OEM will no longer work on this product. And that's where we step in, because we, not being the manufacturer, we're not bound by that. We can continue working on this equipment well beyond the manufacturer's end of life and end of support. And it's not just in the oncology software. This is a standard industry practice. Apple, Microsoft, everybody, I'm sure we're all familiar with that. And just because a manufacturer comes out and says that a product is end of life or even end of support, doesn't mean that it's going to stop working. It won't just turn off. And you're absolutely able to continue using that product as long as you need. And we're here to provide support on those products. Thanks, Walter.
Yeah. Hey, and Sam, also, I think as we have all learned in our many years and 10 years in this industry is, the upgrade schedule is often determined sort of as a business need as opposed to a customer need. We see this so very often. It's like ARIA version 11. Some of these older platforms are as stable as they ever were, but the OEM sort of sunsets and end of life those products. So, and then also, Sam, the other big one that we talk about a lot with our customers is, the cascade effect. So if the upgrade is included with your SSA, your software service agreement, what about the hardware? Is that always included, or what's the additional sometimes kind of catch with the hardware costs?
Yeah, absolutely dead on there. That's a huge marketing hook right there. A manufacturer might offer a free software upgrade to existing customers, knowing full well that for you to take advantage of that free upgrade, you might have to spend $1 million to upgrade your clinic, something like that. So there's, the question is, when is free really free? What does your free upgrade really cost you? And it has to be averaged in and balanced out with the cost of everything else in your practice.
Mm-hmm. Good, Sam. What about, and then the other big one that often isn't taken into account, at least in the problems that we're solving here at Dignitel, are the problems about, if there is a crash, or if they do go down, or if there is, some hard down in the department, what's the usual, just getting on the OEM schedule to get those upgrades? That's sort of a painful part of the process too, yeah?
Yeah, it's absolutely huge. And matter of fact, the case study that John's going to talk about for a minute, that was one of their deciding factors to come to Dignitel. Is they went back to the OEM and of course, we can upgrade. Of course, we can do this. It'll only have to take this particular, upgrade to your clinics, things like that. And oh, by the way, we'll get you in the upgrade schedule. The next available opening happens to be 8 months down the road. And looking at who's in the audience right here, I don't have to tell you guys what that means for your practice to be shut down for 8 months, waiting on a vendor to come out and do an upgrade. That's just unacceptable.
Good, Sam. Thank you. So this is sort of the topic that makes Sam froth and get pretty excited and stuff. And so, Sam, let's go ahead and dive into backups, right? This is the biggest topic that we see in this industry sort of being objective and now away from OEM after these last, almost 5 years of Dignitel. But, backups and where's the disconnect? I mean, right? Clinicians think that they have backups and it's covered by OEMs. And go ahead, Sam.
Right, thanks. So yeah, we've talked about this, and there's a lot of ways to go into this, but the bottom line is there's some hard and fast rules we need to have about backups. You got to test your backups, because it's not really about the backups, it's about the restore, right? You can have the best backups in the world, but if you can't restore them, it doesn't really matter. So the usual strategy, and I've not discussed this before with Walter, but the usual strategy is you go back and you call the OEM and you say, hey, my server's failed. I need you to come rebuild my ARIA system. I've got the nightly dumps and things. And in the case, for example, that John's going to talk about in our case study, the software was beyond end of support. So the OEM was actually unable to restore, even if they did have backups. So there's a fine line in there that if you want to rely on the OEM to help you restore your backups or even do a partial rebuild on your system, then you need to understand what the actual requirements are and whether it has to be current software or if it can actually restore the old stuff. So in addition to just, making sure you've got good backups and you can restore, you have to have a backup strategy, a plan as to how you're going to implement this.
Hey, Sam, where do most data failures happen? Most
data failures, and certainly the ones that we run into, the ones that I ran into at Varian all the time, have to do with server failures and the database. They've lost data. And if anybody is in the audience from IT, usually you get a request to restore a backup because a customer deleted a document and they need you to go back to last night's tape and restore that. Well, it doesn't happen in the oncology world. It's a different type of backup. It's kind of an all or nothing. So what we see on the ARIA side is that most of those failures happen because of a power issue. There was a power hit or the server went down unexpectedly or something like that actually caused physical damage to the database. So that's the number one issue, is the database itself has become somehow corrupt and needs to be restored.
Mm-hmm. Very good. Very good. And then Sam, tell our audience, I mean, everybody sort of joined in here. What's the 3 simple steps, to ensure that you do have bulletproof ARIA Mosaic backups?
Yeah, awesome. So there's 3 things I want the takeaway from this to be. The first is you have to test your restores. You could be backing up for years and years and years, and if you've never actually tested a restore, how do you actually know that your backups work, right? So you have to have some mechanism in place to either restore the entire system or at least make sure that you can restore the critical pieces, right? So that's the first thing. You got to have backups, and of course, you have to know that they're good by testing. So the second thing is unique to ARIA, and this is where we see a failure with IT departments, is they don't have Varian's inside knowledge. And that's when you go to restore your system, it's critically important that you restore all the components at the same point in time. For example, if you've got your ARIA database and you're storing patient data, you've got treatment histories, you've just done a treatment, it's written back to the database, and that's the point in time that you've got your backup, you want to restore your database. It's absolutely critical that you go to your image folders and your image directories, which might be on a totally different server, and those have to be restored back to the exact same point in time that your database. So your database is synchronized to those image files, and most people don't know this, but a lot of the treatment field history, TFH, is stored over in the image folders, and all the Eclipse overlays, all that treatment planning data is actually stored in the image directory, not in the database. So if you don't synchronize these as you do your restore, you run the risk of only being able to restore part of your data. You can only restore the images, or maybe you can only restore the demographics, but you have to go back and replan every single patient. So the second big takeaway is when you do these restores, plan on synchronizing and doing all of these restores to the same point in time across the board. And the very last thing, the third point, and this might actually be the biggest one in this day and age, has to do with ransomware and viruses and things like that. And it's that when you make these backups, it's absolutely critical that at least one copy be stored completely offline, what they call out-of-band management, right? So a lot of these ransomwares and viruses that are going right now, they will actually list all the files on your server. And if you've got any live backups that are stored on the same hard drives, or even maybe plugged in or on a network drive, if those files are live and online, they're just as much of a target as the actual database itself. You can expect to lose all of your backups that are online. That's why it's so critical that you have at least one copy that's completely offline. I mean, we used to say that was disaster readiness, disaster preparedness. In case of a fire or flood, you want one backup copy that's in a different building, something like that. And now with ransomware, that's what we see as the biggest threat, is it's absolutely critical that you be able to restore from a completely separate, independent backup location. So that's the big takeaways. Number one, test your backups. Number two, make sure your backups are synchronized so you can restore them all at once. And number three, make sure you've got an off-site copy just in case.
And I think 3A is call the experts at Dignitel for any input.
We can absolutely help you with this, you bet.
Hey, last topical point here that we want to make, John and Sam, if you can just sort of walk us through this large Midwestern hospital that ultimately found us together, found the Ross channel partner, brought the opportunity here to Dignitel, and ultimately talk to us about some of those details. John, if you want to introduce that a little bit.
Yeah, sure. Thank you, Walter. And that's, one of the reasons I'm here is to talk about a very recent example that's very, very real and really helped us a great deal. But yeah, so one of our clients years ago purchased a refurbished linear accelerator. And as I mentioned earlier, a lot of our clients are price sensitive, right? So they can't afford, brand new equipment, brand new software for whatever reason. In this particular case, it was a facility in an environment with low patient volume. So they just didn't have the patient volume to afford the latest and greatest, right? And most of our clients are either in those environments or in low reimbursement environments, like in Latin America, where they're just, you can't afford, to cover equipment because of low reimbursement, or in many cases, it's a startup brand new cancer center, and they just don't have the capital built up yet. So this was one of those cancer centers that was operating in a low patient volume environment, but they were one day hoping to build up their practice. And so they had not yet gotten to the point where they could purchase a brand new LINAC or brand new software. And that's ultimately what we want for all of our customers, right? We want to get them up and running so that eventually they can buy the latest and greatest. But not all customers have that ability. And in this case, this one didn't. So it was a customer who had an older version of ARIA, running alongside this refurbished LINAC. And lo and behold, the ARIA crashed, and they were forced to stop treating their patients, which was, sort of the worst case scenario when you think about it. And of course, the first thing they did was they called Varian, and Varian looked at it, and in fairness to Varian, this was a very old software version, not very old, but it was no longer supported by Varian. And they said, listen, we can help you, but here's your option. We've got to put you into a newer ARIA system. And that means, there's going to be some downtime. There's going to be some expense. We'll finance it. We'll help you through it. But unfortunately, you got to upgrade. And unfortunately, our client just was not ready for that yet. They didn't have the budget for it. They couldn't put themselves in that position. And out of desperation, they didn't know what to do. Were they going to shut down the clinic? Were they going to, refinance everything? But they called us, and fortunately, we were partnered with Dignitel, and the rest is history. So with that, I'll let Sam describe how he was able to magically, restore this customer back into operation and into security and into treating their patients. So we were just really thrilled to be a part of that. It's a great example of, this new entity that now exists, called Dignitel, that can help clients in need all over the United States and all over the world. So Sam, why don't you sort of briefly describe what
Sure
what
thing,
the magic
John.
was there? Mm-hmm.
So real quick, once we made the decision that we were able to help this customer, they were going to work with us, we connected in, took a look at their servers, and in fact, they had lost their database server completely. There was nothing to be recovered there. ARIA was gone. It was a Windows failure. Their hard drives failed. The server was completely gone. So we were able to look around and see what they did have. They had been making backups for a long time, but nothing recent. They hadn't made a recent backup tape in years. We weren't even sure if those tapes were readable. So we took another approach and looked around and tried to inventory exactly what they did have that was working. And right away, we found that they had enough distributed copies. They had a T-box that was a great copy of their database. Now, no patient data. And they still had all their images. They had all their treatment planning data. So they had enough different pieces in different locations where we could go in and actually reconstruct it. Now, this particular one, they wanted to move away from physical servers, so we went to a virtual server, and we were able to reconstruct their original ARIA 8 system in a virtual environment and have these guys up and running with all of their images and some of their data after about 5 days.
Fantastic.
Walter?
Yeah, no, that's fantastic. Thanks for sharing. So again, we're going to dive into the Q&A here real quick. We just wanted to conclude this section of the webinar by saying one thing, to reiterate one very important point. We all of us have very deep pedigrees with OEM, Varian, and/or Elekta. We are here to tell you that we are all Varian advocates. We are all Elekta and Mosaic advocates, but more, we're customer advocates. We understand what the customers need from a technical, as well as a business development perspective. And we are servicing software at sites that OEMs are choosing not to service. And we're also servicing sites that are choosing to not pay OEM prices for service. So with that, let's go ahead and transition to the Q&A portion of the webinar. Okay, let's see. This question, do you offer software upgrades? I'll go ahead and take that one. Dignitel does not do software upgrades. We don't do software upgrades. We don't do them for ARIA, Mosaic, Pinnacle. We don't do any upgrades. What we do is we offer, at a minimum, is proactive monitoring. Proactive monitoring to us means 30 minutes of eyes on your network every single day. We're reviewing ARIA log files, Mosaic log files, performance metrics, errors and warnings. We know the exact health of your ARIA or Mosaic network. We know exactly what's going on with it. We offer a help desk support. We also offer, cloud hosted services, fully scalable cloud hosted services. So those are our bronze, gold, and silver packages. We don't do upgrades. We sort of believe that when upgrades should happen, they should come part of that bigger package, the purchase of the LINAC, the software upgrades, whatever platform upgrades from that. Sam, John, throw something at me if you wanted to add anything to that.
No, I think you nailed it, Walter. That's, of course, we can't provide you with Varian's proprietary software. That only has to come from Varian. Same thing with Elekta or Mosaic. Our engineers are all factory trained. In some cases, they're the exact same guys that originally installed these systems, and our expertise is in maintaining these systems. And if you determine that you do need an upgrade, that's fine. We can walk you through that process. We can act as your advocate or a consultant and help you negotiate the best possible deal you can get with the OEM. And coming out the other end, we're still available to provide service even on those upgraded platforms.
Great. Thank you, sir. Let's see. What's this? Do you have a specific program to help us with a backup program? Okay, good. I'll take this one too. Sam, you jump in as well here. Do we have a specific program for backups? We absolutely are product experts in ARIA, Mosaic, sort of medical backups in the industry. The standards, do we do them? Do we have a specific program that does backups? We don't per se. We do a lot of collaborative work with your in-house IT or your contracted IT staff. We give consulting services. All of this is provided through our silver package, which is the help desk support package. The bronze is just a proactive monitoring. The silver is help desk and the proactive monitoring. The gold also includes those, but is cloud hosting as well. So yes, we absolutely do have a backup program that can help your IT get that stood up. Sam, I'm assuming you didn't have anything to add to that. I'll jump in.
No, you've nailed it. It's as you know, it's not feasible for us to be at every customer site and actually manage these backups and swap tapes and do that day-to-day IT department tasks of managing those backups. And that's not what we're here to do. I mean, we're the OEM experts. We don't want to be in the IT business, but we will absolutely partner with your IT guys and make sure that your backups are entirely adequate for all of your needs.
Very good. Okay. Let's see, 2 more questions, I guess, are in the queue here. Is one, do you offer cloud hosting or virtualization services? Sort of the same with backups is cloud hosting and virtualization. Yes, absolutely we do. You know, Sam, probably our next webinar topic would be about on-site virtualization, on-premise virtualization.
Yeah, I'm thinking that would be appropriate, Walter. Yeah, I mentioned earlier in the case study, this customer really wanted to get away from backups altogether. And the easiest way to do that is to move to a centralized backup platform, either cloud hosting or virtualized, get rid of all the physical servers, get rid of those day-to-day tapes. Now you still have to back up your virtual service, right? It's still a server, it holds data. You need backups, but it's done in a completely different manner, a lot more transparent. And the bottom line is that's the state of the art in the IT industry right now, is virtualization. These physical servers that the OEMs have been sending out, that was great technology 10, 15 years ago. And I mean, we cut our teeth on that. Absolutely, we can help you if that's the way you want to go. But if you're looking for something a little more robust and to get out of those, daily swapping tapes out, yeah, we probably need to have a whole separate webinar just to talk about the possibilities with cloud hosting and virtual.
Very good. Yeah. I guess that'll be our topic of our next webinar, which should be a good one, in probably about a month. I think we're going to do them monthly, maybe bi-monthly. Last question here that we have in the queue. Actually, it looks like there's one more here. Let's see. I've been hacked with ransomware. How are you responding to these threats with your customers? Sam, I think that's
yeah, absolutely. I mean, that's the big hot button today. And the bottom line is, if you wait until after you've been hacked, there's not a lot we can do for you. You'll find that all your files are encrypted, and really your only option is to go to backups. Paying the ransom, that never works. So it's critically important that essentially you abandon what you've got, let that ransomware go, and work on restoring your backups, which is kind of takes us full circle. If you don't have good backups, then there's really nothing for you to restore. It really is in everybody's best interest to get control of your backups and make sure you've got absolutely rock stable backups, just in case you do get a ransomware or server failure or power outage or any number of things.
Mm-hmm. Very good. Thank you, Sam. Let's see, we're at about the 28-minute mark, so we've got one last remaining question here. We'll ask that. If there's anything else, John, Sam, if there's anything else we missed, go ahead and plug that. But one more question here. It looks like from another of our hardware service channel partners is Mayfield Oncology, Michael Bianco. What could be the expected realized savings per year over year going from OEM software support to Dignitel software support? That's a wonderful question, my friend. Thank you for asking. So again, and I'll tell you this, is there have been a lot of third-party hardware service companies over the last many, many years in our industry. This is the first time that there is a third-party software service company in our industry. That is very profound, and we've been here over 4 years now and gaining momentum significantly. So Michael, thank you for the question. The savings for the forum here is 30 to 40%. That's absolutely what we coach. We believe, and maybe we're drinking the Kool-Aid, obviously, we believe that our service is at par or even better than Varian. I mean, we really are ensuring with elect and variant, that your ARI and Mosaic networks are absolutely bulletproof by way of us proactively monitoring these networks. So 30 to 40% is the absolute realized savings year on year with Dignitel covering your software as opposed to the OEMs. Thank you, Michael. I think that concludes. We're at exactly 30 minutes. Thank you everybody for joining. We will be doing these webinars often. Please join us again. If you have any topics for future reference, please send those to us here. We'll actually absolutely get those on the agenda. Thank you very much. Have a great weekend.
Thanks, everybody.
Thank you, Walter.
Thank you.